Today, we are going to look at a BodyViz brain builder about the nervous system and strokes. The nervous system, which includes all the nervous tissue of the body, is composed of two subdivisions: the central nervous system, which is abbreviated as the CNS, and the peripheral nervous system, which is abbreviated as the PNS. The CNS is composed of the brain and spinal cord and is responsible for coordinating, integrating, and processing of sensory input and motor output. The CNS is also the location of higher functions, such as emotion, intelligence, learning, and memory. The PNS contains all of the nervous tissue outside of the CNS. The PNS is subdivided into afferent and efferent divisions. These divisions can be thought of as a highway. The afferent division carries sensory information from the periphery to the CNS, and the efferent division carries motor information from the CNS to the peripheral effector organs. The entire nervous system is composed of only two cell types: glial cells and neurons. Glial cells do three things. They help maintain the intracellular environment of the nervous system, provide a supporting network to the nervous system, and act as phagocytic cells within the nervous system. Neurons communicate with each other by structures termed synapses, and they also communicate with other structures, such as a muscle or a gland, at junctions termed neuroeffector junctions. To understand why strokes happen, we need to understand the vasculature of the brain, which is part of the CNS. The brain receives its blood supply from two arterial systems: the right and left vertebral arteries and the right and left internal carotid arteries. The right and left vertebral arteries are branches of the right and left subclavian arteries. These two arteries enter the cranium through the foramen magnum of the skull. The cerebral arterial circle, also termed the circle of Willis, is a circle of vessels on the base of the brain that is formed by union of the four vessels, which are the right and left carotid arteries and the right and left vertebral arteries, supplying the brain with blood. If the brain is deprived of blood for more than a few minutes, there could be an inadequate supply of oxygen and glucose to the brain. This interruption typically results in an infarct of brain tissue, also termed a stroke. A stroke often results in either a temporary or permanent loss of sensory and/or motor function within some portion of the brain. Early recognition of a stroke is essential. The Cincinnati Prehospital Stroke Scale, abbreviated as the CPSS, is a standardized and easy-to-use stroke screening tool. The CPSS tests three signs for a possible stroke, which are speech, facial droop, and arm drift. Let's look a little bit more at each of these. Speech. Individual exhibits slurred speech, utilizes incorrect words and sentences, or is unable to speak. Facial droop. Individual is unable to smile normally, or if one side of the face doesn't move as well as the opposite side, or seems to droop. Arm drift. Individual is asked to hold both arms straight out in front of them, with the palms up and eyes closed for approximately 10 seconds. If both arms move equally or not at all, the individual is believed to be normal. However, if one arm does not move, or one arm drifts downward compared to the other, the individual is suspected of having a stroke. A thorough understanding of the CPSS, even by a non-medical person, can be valuable in assisting an individual that may be undergoing or has recently undergone a stroke. Next, we will look at the symptoms, causes, and treatments for a stroke, and finally, give a patient example. Symptoms of a stroke include trouble speaking or understanding what others are saying, paralysis or numbness of the face, arm, or leg. This often affects just one side of the body. Problems seeing in one or both eyes, sudden and severe headache, and trouble walking. There are two common types of a stroke that have different causes. An ischemic stroke is caused by a blocked artery, and a hemorrhagic stroke is caused by a leaking or bursting blood vessel. Uncontrolled high blood pressure, overtreatment of blood thinners, trauma, and a weakened blood vessel walls are all causes of a hemorrhagic stroke. Treatments for a stroke revolve around restoring blood flow to the brain through various options that can include IV medication that can break up a blood clot, endovascular procedures, which involve inserting a thin tube or catheter directly into the artery to remove the blood clot, surgery to remove the blood and pressure on the brain with a hemorrhagic stroke, medication to undo the effects of blood-thinning medications, and other treatments. Finally, let's take a look at a patient example. You receive your patient's file and take a look. Age, 55. Gender, male. Chief complaints, trouble walking, difficulty talking, and not having strength in his right arm. Your patient has been brought into the ER today by his wife. She felt her husband had seemed off and noticed that he was talking strange and looked slightly different in his face when she noticed he was having trouble walking and using his right arm to hold up a glass of water. She became worried. She recognized that her husband was showing signs of a stroke because when her father had had a stroke, she learned about the Cincinnati Prehospital Stroke Scale. You tell your patient's wife that she did the right thing bringing him in. You immediately send for an MRI and upload it into BodyViz to see a 2.2 centimeter aneurysm. Your patient is on blood thinners because he has a history of smoking and blood clots in the past. Recently, his doctor has increased his dosage. You predict this to be the cause of the aneurysm. You quickly give your patient drugs to lower the pressure in the brain and his blood pressure to reduce the effects of the blood thinners. You plan for surgery to remove and repair the brain aneurysm. This is a classic example of a stroke. Thank you for watching this Brain Builder video. Please like and subscribe to our BodyViz channel. Or, if you are new at BodyViz, check out our other anatomy resources and schedule a demo at bodyviz.com.